morning, everyone. Welcome to Network 2020's briefing on vaccine diplomacy. My name is Courtney Dogger, and I'm the president of Network 2020. I'm honored today that we are joined by Dr. Krishna Udayakumar and Dr. David Elwood, who will be speaking with us today about vaccine diplomacy and global health and the intersection with foreign policy. So just as quick background for those of you who are joining us for the first time, Network 2020, we are a New York-based nonprofit. We are an inclusive international community, and we're really trying to bridge the gap between the private sector and foreign policy worlds. And one of the ways in which we do that is by bringing global experts on topics related to foreign policy and international affairs to talk to our global audience about what's happening, what they're seeing, and then allowing the audience to ask questions. We invited both of these experts here today for separate reasons, but they're both wonderful guests to have. So I'll just start off, and I'm not going to do the full bios again because we want to hear from them, but we have Dr. Krishna Udayakumar, who is really at the forefront of innovations in global health. So his work, as you can see on the slide, it spans a lot of different, he has his hands in many different pots, but they're really all focused on innovations within the global health sphere and really how can one scale solutions globally and bring transformative impacts into global health. And he's doing a lot of interesting work right now also on tracking vaccine distribution worldwide. And so that will be obviously quite relevant for the conversation today. And we are also joined by Dr. David Elwood, who has a very different expertise. He is at the School of Advanced International Studies at Johns Hopkins University in Bologna in Europe. And his work really focuses on soft power, of which vaccine diplomacy is a component. And so that's why we asked him to speak with us today as well. So with that, I'm going to just first of all thank both of our panelists for taking the time today. And we'll kick it off with the conversation. So we'll do about 30 minutes of moderated conversation, followed by about 30 minutes of Q&A from the audience. So if at any point you have any questions that you would like to put in the chat box or the Q&A box, please do, and then we'll try to get to them during the Q&A portion. So I'd like to just start off like I usually do by setting the stage. So Dr. Udayakumar, could you just kick us off by giving us the sense of what the state of play is in vaccine distribution worldwide? And I know you've done a lot of really interesting work on this and maps. And so, I'd just love to hear, what does that tell us about vaccine diplomacy or vaccine nationalism? And just to help us understand what's at stake and why this is so important.
Sure, absolutely, Courtney. Thanks for having me on. Great pleasure to join you along with David today. I've got a couple of slides, if you're able to bring them up, that show just where we are in the world. And to start with, what is the burden of COVID? We're now reaching almost 150 million cases around the world, 3.1 million people dead. You see there the greatest burden has been in the US here, but unfortunately, huge rise in India recently. They've just set the world record for the number of cases 4 days in a row and is still going terribly in the wrong direction. We see terrible loss of life in Brazil as well. And so what I take away from this is it's highly dynamic. So people who thought they may have dodged a bullet aren't faring so well months later. You can see on the chart on the bottom right that the total number of cases around the world continues to go up week after week. So we are actually at one of the worst places in terms of the global pandemic, which is ironic because we now have many vaccines that have been developed in record time and that are safe and effective. So if you go to the next slide, you'll get a sense of what's happening in terms of vaccines. And what we've been tracking is all the publicly available data over the last 6 months or so of what's happening in terms of the purchases of vaccines. And before the first vaccine was even approved, we had billions of doses that were already spoken for. And what we're seeing as of this week is that 8.9 billion doses of vaccine have been purchased, nowhere near that delivered or administered, of course. And what's really playing out is the inequity that we had hoped to avoid. High-income countries that make up about 16% of the world's population have bought more than 50% of all vaccine doses purchased to date. We'll come back, I'm sure, to COVAX, this multilateral platform that was aspirationally hoping to serve as the global clearinghouse for vaccines, and especially to provide access to the poorest countries in the world. And we see that it's been able to purchase about 1 billion, but nowhere near as much as necessary. So if we go to the next slide, you'll see not just income levels, but by countries, and not surprising to those of us that work in the health arena, but still incredibly frustrating, is that the global south, if you want to call it that, largely Latin America, Sub-Saharan Africa, and most of Asia, continues to suffer and is much less able to get access to vaccines, which at the end of the day are going to be a major intervention to end this pandemic. Going to the next slide. So those are purchases, and where are we in terms of manufacturing? Well, there's good news and bad news here. If we take the publicly available projections from all of the manufacturers, which is what we've shown on the waterfall chart on the left here, that we could potentially get 8 to 10 or even more billion doses manufactured by the end of 2021. That's the good news. The bad news is those are wildly optimistic numbers, and we haven't seen any manufacturer actually hit their initial projections, because turns out vaccine manufacturing at scale is really hard. It requires not just bulk drug manufacturing or fill and finish, but access to supply chains that cover dozens of countries. And we've seen now things like export controls and the rest also play a role here. So on the right-hand side, you'll see for each vaccine candidate, how much they have said publicly they're able to produce in 2021 relative to how much they've actually sold. The big takeaway here is the world is really betting on AstraZeneca, Oxford, as well as J&J, because most of the purchases from low and middle income countries are coming of those two candidates. And we see the mRNA platform, the Pfizer, BioNTech, and Moderna to date, really predominantly being delivered to high-income countries. And so the last slide, okay, we've now looked at who's buying vaccine doses, the manufacturing. So what's actually happening in terms of distribution? Just yesterday, we hit 1 billion doses administered in more than 170 countries. Overall, good news from numbers, but if you disaggregate the number, the same inequity playing out. You'll see the map on the left-hand side where, again, doses administered by 100 per 100 people, a huge gap in Sub-Saharan Africa. And if you look at that billion dose, and if you break it out, the US, Europe, China, and India account for about 70%. So the rest of the world is really fighting over scraps at this point. So we can end the slides here, but the major point is really that we know that this is not just a global health issue, but one of security, diplomacy. And so the places where the vaccines are being manufactured are not the places where they're most needed. And as I mentioned, we're seeing both vaccine nationalism on one hand with export restrictions, and vaccine diplomacy on the other, with differential access to vaccines based on existing or intended influence. So that's where we stand from a high level in terms of access to vaccines and what's needed to end this pandemic.
Thank you very much. Before I turn to you, Dr. Ellwood, I just wanted to follow up with one question. If you could, because these maps are very helpful, I think, in charts in terms of setting the stage. If you're looking at this as a practitioner, as a global health expert, where are you seeing, particularly when it comes to the inequities, where are you seeing doses either being donated or covered for the countries that need them? Like, where are they coming from? What are some of those flows that you're seeing happening?
Yeah, so the biggest multilateral approach we've seen is COVAX, again, brought together by the World Health Organization, Gavi, the Vaccine Alliance, and CEPI, with now support from UNICEF. They have been able to distribute 45 million doses to 100-odd number of participants, as that last slide showed, but that's less than 5% of the global doses administered to date. So while they're been able to make sure that almost every country in the world gets access to a few doses very early on. They have not been able to ramp up in terms of supply to the extent needed. And that goes, if you track it back, straight back to India. Most of the initial doses that were contracted came from the Serum Institute. And we know that the burden is such in India that all of the manufacturing capacity is being diverted to domestic needs. And so what's playing out in terms of export restrictions in India is understandable because of the terrible tragedy that's unfolding right now, but it's having downstream effects on access through this multilateral mechanism. On the donation side, we've seen actually India's exported 60 million doses, including more than 10 million that they've donated largely to their neighbors in South Asia. We've seen tens of millions of doses also coming from China, especially influencing Latin America and Sub-Saharan Africa. And then we have seen the Russians set up manufacturing and do a little bit of export, but they don't have quite the same manufacturing workhorses that India and China do to actually be able to export at scale.
Okay, thank you very much. Now picking up on that and turning to you, Dr. Ellwood, you focused a lot of your work on the topic of soft power. And so how do you see vaccine diplomacy fitting into that paradigm? And by your measurement, which countries are doing well at utilizing this particular moment of soft power potential?
Well, for me, soft power is about the relationship between hard power, which is military, and economic and political, and influence. The name of the game is influence. Everybody wants to be an influencer, to have likes and followers. Actually, influence is quite a complicated concept, and I've got something like 28 synonyms for influence. But to my way of thinking, the most effective connection between power and influence is the force of example. And this is a phrase I invented long before Obama and Biden expropriated it from me. And the force of example, which is most effective and most incisive and most enduring, is your model of innovation, your model of change, your model of progress, your model of invention. Now, historically and normally, these dynamics work out over long periods. That's why I call the American century the century of innovation, the century of the American challenge. What's different about the vaccines is suddenly the challenge has become tactical. The Chinese, the Russians, and for a while the Indians have been trying to demonstrate that you can use one of your innovations in a tactical fashion in the middle of a global emergency. And that's what they've been trying to do. And a lot of people in the media picked up on this, and I've got all kinds of headlines about who's leading the soft power push with their vaccines and our vaccines and the others' vaccines. In reality, this situation has changed quite dramatically because nobody's winning the soft power competition in vaccines. Nobody. The Chinese vaccine has shown to be much less reliable than is expected and has disappointed various people around the world, such as the population of Chile. The Russian vaccine, as Krishna said, is not produced in significant enough quantities to make a big difference anywhere, perhaps outside Central Europe. And of course, everything that Russia does is overshadowed by geopolitics, the bearing of Putin in his relationship with the others, their subversive tactics, the fact that they have an ongoing disinformation program about other people's vaccines, as confirmed by the State Department, and then India, the Indian disaster. This afternoon's Financial Times has an article on the perils of hubris, and in that article, which is by one of their leading editorial writers, he quotes Modi saying, "I have beaten the vaccine, I have beaten the virus." A quote from about 3 months ago, 2-3 months ago, in which he's telling a party rally, "I have beaten the virus." And he allows mass meetings to go on. He allows gigantic religious meetings. He's allowed gigantic religious meetings to go on. He's allowed huge cricket matches to go on. And now he's paying the price. So the Indian soft power push has collapsed completely. Who does that leave? Well, it doesn't leave many people in the game. There are no winners at the moment. we will have to see what the Americans are doing. Will this, the new kind of activism of the United States towards Mexico and Canada, one or two other places, that may raise the profile of America in this competition. But for instance, the Americans are not exporting to India. Lots of people are doing emergency exports to India, such as the European Union, and the US is still not doing it. The situation will change, I've no doubt about that. But right now, nobody is winning the soft power competition. But there's a new twist. There's a new twist, and it's this. The British thought they were ahead of the game with AstraZeneca, and Boris Johnson talked about Britain as a science superpower. And as Krishna knows much better than me, the AstraZeneca vaccine has not lived up to all its promises. But the early rollout of the try and control the virus, that went very badly in Britain. But the British have now excelled in rolling out vaccines, in vaccinating huge numbers of people. That's been a great success for them. And it's had an international spillover, which I just read about this afternoon. More international students want to come back to Britain to study because they are checking out where the most effective vaccine control programs are working, and Britain is at the top of the list. And of course, they already have a huge foreign student population. They use it, they're very keen on marketing their universities. They know too that that's a competitive game with America, with Australia, with various other places. And so without any warning, suddenly without anybody imagining what was going to happen, this has turned into a soft power asset for them in the new situation.
All right. Thank you. Thank you very much for that assessment. Dr. Udayakumar, turning back to you, I wanted to pick up on something that you had mentioned earlier. You were talking about the COVAX facility and what it's designed to do, and that it's basically, I think, and correct me if I'm wrong, but I think it's reached about 5% of the population. Is that it, or only 5% of what it's supposed to do? I will let you correct me on that, so no one quote me. But could you talk a little bit more about what the situation is with COVAX? Because this really was designed to be the best international response, and why hasn't it worked quite the way that it has been designed to?
Yeah, we are just about a year exactly as of last week from the development and launch of COVAX as a part of this broader ACT Accelerator. So very quickly, as we recognized a year and some weeks ago, that we were in the midst of a public health emergency around the world, there was the development of a brand new model of governance and collaboration. So one lesson learned is really you've got to go into a pandemic better prepared, so you're not developing these new models on the fly. COVAX became the vaccines platform for ACT Accelerator, and really was thinking about how to ensure better equity in terms of vaccine access relative to what we had seen with H1N1, for example, where almost all the vaccines that were developed were initially hoarded by high-income countries. So the intent there was twofold. One is to take the 92 poorest countries in the world and make sure that they could get access more quickly than they would otherwise, and subsidized access through donor aid and assistance. The second part was to act as an insurance platform, because we had no idea which vaccines might work or not. There were dozens under research and development. So by pooling investments, they could invest in a portfolio, and that would support the high income and middle income countries of using that platform to de-risk their own purchases and investments, and in return lead to more equitable results. We've seen parts of those work. Right? So the AMC, the Advanced Market Commitment component, getting out to 92 low-income countries, almost every country now has received some doses of vaccine. So much more quickly than would be anticipated otherwise. Where they are still struggling is one on the financing side. We're a year in and still trying to raise billions of dollars for vaccines, and we're still $20 billion short almost for the entire ACT Accelerator just to get through the end of this calendar year. So a year in, we have not been able to raise anywhere near the $33 billion that's required for a comprehensive global response. for vaccines and COVAX, even if they're successful in meeting their 2021 targets, that would mean somewhere in the order of 20 to 25% population coverage for the poorest countries in the world, which we know is better than nothing, but nowhere near enough to reach herd immunity. So we've started to see almost every country in the world work around COVAX and complement COVAX through their own purchases, including the African Union and the Africa CDC, that have, in addition to what they expect to get from COVAX, gone out and made purchases of about 770 million doses of vaccine in addition. So I would characterize COVAX as necessary but not sufficient. It brings us a mechanism by which to make sure that equity and access remain on the agenda, by which to have concerted conversations about the best pathways forward, but to date has not been the predominant method of either buying or delivering vaccines.
Thank you. And just to follow up, so that 20 billion, I mean, I assume that they go into this with a plan. Is this just unfulfilled pledges or promises, or was it just a hope that that money would turn up somewhere? And if they had that 20 billion, would they be able to follow through on their commitments or their goals?
Yeah, if you look at the breakdown of the 33 billion goal, that cuts across 4 different areas. One is vaccines, but also testing or diagnostics, treatments, as well as health systems connection and strengthening. And the vaccine space is actually the best funded. It's still about $1.5 billion short of what it needs out of about 8.3 billion to get through the end of 2021, which means the rest of those other 3 pillars are much less well funded. So we're not doing anywhere near what we should be in terms of supporting testing, treatments, as well as strengthening health systems. Partially, it speaks to the disjointed nature of financing for health, that this is separate to what the multilateral development banks have done. The World Bank has pledged $12 billion. The Asian Development Bank and the IADB have put another $9 to $10 billion on the table, but not through the same mechanism. So there might be some level of coordination, but we're now separately looking at financing what health systems need and countries need. Secondly, while Gavi is doing a fundraiser for COVAX, UNICEF is in parallel doing a fundraiser for UNICEF and the needs that it has. So it's not clear that there's a single mechanism. So we have a lack of coordination, which comes from a lack of governance. So when you've got 3 or 4 organizations in charge, that means really nobody's in charge.
Okay, thank you for digging in on that. Switching gears a little bit, Dr. Ellwood, I wanted to turn to you. We're changing gears from the international space to looking at more national agendas. So you had mentioned that vaccine diplomacy is really a tactical soft power issue. How
Yes.
are countries like China and Russia using vaccine distribution as an extension of their political agendas, and is it, and I know you said right now there are no winners, but do you see a potential for this to work or not?
Well, there are people who are saying that the Chinese are putting health diplomacy in the broadest sense of the word right at the center. They're shifting it to the center of their Belt and Road Initiative. So I think we can be sure that while they are trying to do their best tactically in the emergency, they will be thinking in the long term about how to project their health expertise in all its forms, along with the infrastructure systems and the infrastructure proposals of the Belt and Road Initiative. I think we can bet on that fairly safely. They did, when they announced their vaccine diplomacy, they did so with very lofty moral declarations of moral principle. Well, we don't hear much about them right now, but nevertheless, they will be trying hard to compete. Now, until quite recently, there was a very obvious vaccine competition in South Asia between China and India, and one country that was caught in the middle of that was Myanmar. And the leader of Myanmar said that she would choose the Indian in order to fend off the invasiveness of the Chinese. She would choose the Indian vaccine for her country. Before the great crisis that India is living through right now, India had distributed vaccines all around its neighborhood, all around South Asia, and also to South Africa and places like that. Well, they've fallen away. I think we shall have to wait to see what the Chinese will do next. They don't have such a strong record in vaccine production, vaccine research as the Russians do. But I feel absolutely certain that they will wish to think strategically and think beyond this moment. The Russian case is different and interesting. As Krishna, I'm sure, knows much better than me, the Russians do have a respectable track record in developing vaccines. And even during the Cold War, they were collaborating with the West on things like smallpox vaccines and polio vaccines. Nobody knows, we'd only kind of rediscovered that in the present emergency. So they do have a respectable record in that sense. And so their vaccine is credible. It still hasn't had the final seals of approval from the Europeans, the British, or not much less the Americans. But it's not unreasonable to think that they will get it. The question is, what will they then? How will they then proceed? They have been distributing their vaccines through Central Europe. They've been distributing in Latin America and distributing in parts of Africa as well, competing head-on with the Chinese in Northeast Africa, for instance. The problem is that everything that Russia does is overshadowed by all this aggressiveness of theirs. And the fact against everything in the West, against the EU, against the United States, against NATO, against anybody who dares to speak up against them, speak out against them. A lot of experts are saying that Russia is very much on the back foot, is very much on the defensive, and this is making them more aggressive because the economy is weakening. Putin's hold on his population is weakening. The opposition is getting more and more courageous. And the Navalny case is under everybody's eyes, is before everybody's eyes. So how are they going to manage in this situation? So everything they do on the vaccine front, which may be positive and may actually win them some friends and influence some people, is countermanded, is undermined by their aggressiveness in so many other fronts, including the internal front. Having said that, another aspect of this story is the number of Russians who've been vaccinated is really very small. I can't remember what the latest figure is, something like 4 or 5% or maybe less. And that's not simply because of the Kremlin. It's also because there's huge vaccine skepticism in Russia. There's a huge anti-vax movement. They don't want, so many people don't want to know. And that's a problem in all kinds of countries. They had it in France, of all places, for a long, long time. And places like Japan obviously have a problem there. Japan is a very strange case. It's something like 1.8% of people have been inoculated. And the EU is sending vaccines to Japan, of all places. They thought they could get away with preventive measures, and that turned out not to be true. But the Russian case is extremely, extremely paradoxical, extremely enigmatic, and right now I can't see them getting any benefit from their vaccine diplomacy. They're closing down news agencies, they're closing down radio and television stations, they're trying to block the internet, all this kind of nonsense. So whatever they may gain with their vaccines, they're likely to lose on so many other fronts.
All right, wonderful. Thank you very much, Dr. Ellwood. Dr. Udayakumar, are you there?
Yeah,
yes.
hi.
Okay, all right, wonderful.
Sorry.
Great.
Decided to take this time to restart itself, so I apologize. If you can see me and hear me, we're good to go.
Yep, we're good to go. Great. We have an active Q&A box, but I wanted to get one more question in before I turn to the Q&A box. And so you had mentioned earlier, you were talking about sort of the lack of coordination, the lack of leadership when it comes to things like COVAX. And you had also talked about, or across, I guess, some of the international systems in general. And you had also talked about supply chain very briefly. And so I wanted to follow up and see, when it comes to multilateral institutions or mechanisms to coordinate things like supply chain and licensing, because I think licensing is something that is increasingly popping up. Are there a role for international institutions, and are they playing an effective role?
Yeah, thinking about access to materials, the supply chain, certainly brings in the World Trade Organization to the mix, and what we have started to see play out over the last few months also is a broader conversation about power dynamics, as evidenced through something called the TRIPS waiver. It's the international property
question. Exactly.
Right, exactly. And so the India and South Africa have led now what are more than 50 countries supporting the waiver of specific patent and other intellectual property rights in the midst of a pandemic, with the hope that that would allow greater supplies to be developed and more manufacturing of everything from personal protective equipment to vaccines. That has to date not been supported by several high-income countries, most specifically the US. And so the question really becomes, what are the true bottlenecks in terms of getting comprehensive manufacturing capacity built up? And when we've looked deeply at the research on the supply chain and requirements for vaccines, you have to take a very comprehensive approach. So patent waivers on their own are very unlikely to result in increased vaccine manufacturing over a period of weeks to months. You've got to have not just the patent, but access to actual know-how that sometimes is on paper, that sometimes lives in people's heads. You've got to have access to these intricate supply chains. Like what we just saw yesterday was the national security advisor to the US finally come out and say the US has identified specific raw materials that are needed for the Serum Institute of India to ramp up manufacturing, and are now going to provide it. So even with the license of the IP, which is what the Serum Institute in India had, it really still needs access to the raw materials, the ingredients, the supply chain. And so if you create a free-for-all with a lack of patents, and you have even more manufacturing sites, the limitations are not the bulk drug manufacturing. The limitations are actually all of the upstream products, whether it's the lipid nanoparticles for the mRNA vaccines or the bioreactor bags for some of the viral vector vaccines. And so if you create a more disjointed supply chain, you might actually reduce overall productivity. So what we have argued for is a much more comprehensive approach that has to be multilateral, but also requires much stronger US leadership for global action.
I think you also risk piracy. I think you also risk piracy and fake vaccines and all this kind of stuff.
Absolutely. And we just saw reported that in Mexico, there were people that were paying $1,000 for counterfeit Pfizer vaccines. So,
exactly.
So you've got to have real supply provenance included. Yeah.
Yeah. Thank you both for that. I'm going to turn to the Q&A box now. And the first question I'm going to take, actually, it might be one of your colleagues, Dr. Udayakumar, and this is for you, Dr. Ellwood. So Ernesto Ortiz is asking a question for, your thoughts about Cuba, another potential player on the soft power influence with support of China and also Russia. They have 2 vaccine candidates on phase 3 trials and apparently showing good preliminary results. And they're in conversations with several Latin American countries about expanding their clinical trials. What are your thoughts on Cuba as a player in this?
Can I answer that?
Yes, yeah, it was directed to you. Yes, absolutely.
Yeah, well, by pure chance, I have a Cuban student who's writing her MA thesis on Cuban health diplomacy, which goes back 60 years. It goes back a long way to the very early years of the Cuban Revolution, and of course was supported by the Soviets. And they think of that as part of their fundamental identity, this health regime and this health culture and this health presence around the world, in the developing world, of course, in the developing world. And they've put a lot of resources into it, and they're actively working on it. Right now, they're trying to develop a vaccine with Iran, of all people. But you can be sure that they will be using their existing connections and their existing channels in the third world to promote their vaccine when they eventually come up with it.
Thank you. Dr. Udayakumar, we have a question about the infrastructure, I think, of vaccine distribution. And so it's, someone's asking, it's great for wealthy countries to donate doses to lower income countries, but if you can't get shots to people in rural areas, or if doses go bad because they can't be refrigerated, what's the point? So could you comment a little bit on what infrastructure is necessary, is it in place, and how is that being handled?
Yeah, I think that's a really important point in all of this. We do know that it's not just getting vaccines into ports or off planes. It really is about getting all the way to the last mile and getting jabs in arms. That's most important here. We just saw a story, and there was an article in the Wall Street Journal yesterday, for example, that followed a dose of vaccine all the way 1,500 miles across India to get to a very rural place. So it's incredibly difficult in terms of the supply chain, the cold chain management, the logistics, the distribution. And this is another place where we can and should be doing more. That, as I mentioned, the World Bank and other multilateral development banks have funds available that are not fully tapped out to support health systems at the country level, but they're not using the same mechanisms or the same platforms as the way that we're getting vaccines into the countries. What we think might actually work is to leverage our prior experience from US leadership in blending bilateral with multilateral approaches. So in response eventually to the HIV and AIDS epidemic, we created PEPFAR, the President's Emergency Program for AIDS Relief, and in parallel, the Global Fund as a multilateral approach. And so there is significant expertise in supporting health systems infrastructure from PEPFAR, as well as the Global Fund. So trying to look at those blended multilateral, bilateral approaches, we think can be much more successful in ensuring that the actual last mile and the delivery capabilities are also met.
Thank you. This next question is for you, Dr. Ellwood, and it's a question from Kyle Marston, and he's asking about whether or not the U.S. has a moral obligation to get vaccines out. And so I'm going to put this in the context of Joseph Nye, who's spoken to us, who's also talked about, whether or not, is foreign policy moral. And so, yes, there's the idea of influence and soft power, but is there a moral obligation as well?
Well, I think if you're Joseph Nye, you would say yes. As the power which pretends to offer a certain model of leadership, including moral, to the rest of the world, then the obligation is there. Of course, different administrations interpret this obligation in different ways. America First is the exact opposite of that, and there's no question. There have been so many setbacks to America's attempts to offer leadership to various parts of the world, especially the Middle East, that administrations have become much more cautious and much more defensive about doing this kind of thing. And there've been there's so many contradiction, paradoxes in the way this leadership has turned out in various parts of the world. I mean, the whole story of development, development was the big dogma for about 40, 50 years after World War II. And all that has worked out in extremely ambiguous ways, to put it mildly. And then, of course, everything that's happened in the Middle East has been a giant setback. And now we have, Afghanistan wasn't simply about occupying the country militarily. It was also about rebuilding democracy and bringing liberty and bringing education and bringing women to liberation, education, and so on and so forth. There have been so many setbacks that the administrations these days are naturally very cautious about promising anything in the way of leadership. If you take the government agency, which is supposed to support foreign aid and is supposed to support public diplomacy, the Global Agency for Media, that's in big trouble. President Trump tried to subvert it and put his own people in with their own very militant agenda. That didn't work. He didn't get away with that. So that agency has to be, in a certain sense, rebuilt. And my colleagues at the School of Public Diplomacy in the University of Southern California are working on this and working with high-level people in the administration to try and think about that at least. So I think certainly as the richest nation in the world, with the largest number of rich people, and of course the home of the key vaccines as well, between the public and the private sector, because all these things are combination of public and private when you look. As the home of some leading research universities, including Johns Hopkins, of course, my own, then it has a moral obligation to lend its support and its assistance to the rest of the world, including exporting vaccines. I do believe that. And
if maybe I could just build on that. So I fully believe there should be a moral, ethical obligation here. In the midst of a pandemic, right, there are actually alignment with even self-interest as America First means we actually should be sharing vaccines. That we know that not only is it the right thing to do to save lives around the world, but if we're worried about the health of Americans, then we want to make sure that there are no infections happening in other parts of the world that lead to new variants that eventually are going to make us more susceptible because our current generation of vaccines won't work. We also know that if we want our economy to recover and grow more quickly, we need global markets, we need global economies, we need trade, we need travel. So there's alignment, whether you're self-interested or you want to take a moral imperative to this. And I think we have communicated pretty poorly across our community that it's not health or the economy, it's not help the world or help ourselves. There's significant alignment that we're missing the opportunity on.
I mean, I understand that the US has started exporting vaccines to Mexico and Canada. So a start has been made, and I thought that southern flank would be absolutely crucial, given the kind of countries and the kind of social situations they're in.
Yeah. So it's not always an either or situation, but we need to find the middle ground. I was going to ask a different question, but that raises a new one that comes from the registration from one of the attendees who registered, and that's about the question of surplus in the U.S. If there may soon be a surplus, and what do you see happening with that, and at what point do we stop hoarding vaccines for ourselves and distributing them elsewhere?
To start that, I think if you look right now, there are 65 million doses of vaccines that have been distributed that are not yet administered. And that number is growing every day because we are right now hitting the inflection point. And that's going to become a much more visible inflection point where it's demand, not supply, that's the bottleneck for vaccinations in the US. So the rate of vaccination is going to slow down significantly, unfortunately, in the coming weeks. Our projections have shown that we could, in the summer, have several 100 million doses of vaccines beyond what we need in the US. If you look at Pfizer, Moderna, Novavax, AstraZeneca, and Johnson & Johnson, which are 3 approved or authorized now, and 2 more that are likely to have emergency use authorization over the summer. We have also argued that it makes no sense to keep a large number of doses on the shelves over the summer when the rest of the world most urgently needs them. The 2 things that are most helpful to think about in terms of when we would need more doses of vaccines, one would be if there are variants that break through our current coverage. For those, we would likely need new generations of the mRNA vaccines for coverage anyway. So keeping the old generation on the shelf is less likely to be helpful. Secondly, the duration of immunity may wane over time. So we may be looking at seasonal vaccinations going into the fall and the winter for all adults or kids 12 and over as well. For all of those needs, our research again has shown that the US-based vaccine manufacturing capacity by the fall and winter will be 200 to 300 million doses a month. So we will have plenty of supply by the end of the year to meet our needs without having to keep them on the shelf or in freezers over the summer. So the right thing to do, we've argued strongly and advocated for, is really to start sharing doses over the summer into the fall, and having comfort that any needs that we would have into the future can still be met.
And just thank you. Picking up on that and turning that to you, Dr. Ellwood, from your perspective as someone who looks at soft power, what happens in the scenario that the US does not release those vaccines from the shelves? How does that affect US standing in the world?
Well, if it doesn't do that, yes, it doesn't help US standing in the world. US standing in the world is picking. It had a high, for better or for worse, whether you like it or not, in the Obama years. There was a sudden pickup. Anti-Americanism just collapsed, and then, of course, along came President Trump, And all the opinion polls around the world registered the collapse in respect for the United States. But we must let's not get confused about this. We mustn't ask or answer the question, what do you think about the US? To me, that doesn't mean anything. It's like asking, what do you think about Ecuador? Are you more pro-Ecuador this week than you were a year ago? And so on. You have to separate out the actions of the federal government, the way the nation functions as a society, and thirdly, Americanism, the ideologies which are expressed in the founding documents and which make America the last remaining ideologically based nation in the world, in the free world, I should add, unless you include France. So Americans worry very much about their standing, but they ask the wrong question. What do you think about America? And it's not, you can't say that. Are you more pro-Norway this week compared to a week ago? This kind of question doesn't make any sense. You have to make this distinction, but the whole anti-Americanism concept confuses that and mystifies it. Nevertheless, having said that, there are precedents for American action on the health front, on the health diplomacy front. President George W. Bush made a significant effort against AIDS in Africa, especially Northern Africa. He didn't get much credit for it, it must be said. I don't know whether that was the fault of administration or the local people, but it's a fact that anybody who knows that part of the world is aware of what America did for that, for against that disease at that particular time, around about the 2000s. So there is a chance, there's certainly a great chance for the US to make a big effort on this front. The trouble is what happens when the pandemic is conquered? Will we just close the window and move on? Everybody knows there are going to be more pandemics. Everybody knows we should be more prepared. We should all together with all the various alliances get prepared for these. Simulation exercises were carried out in the US and the UK around about 2016, and the lessons were there to be learned, but they were not learned. So we ended up in this mess. At this time, it must not be allowed to happen. It doesn't matter who's leading it, whether it's the G7 or the G20, or whether it's the US alone, or whether it's NATO, or whether it's US and the EU. It has to be done. The leadership has to be shown that we need to be prepared. We can be prepared for the next time. There is a real risk that once this emergency, just like the previous emergencies, SARS, Ebola, foot and mouth disease, once they were finished, people just moved on. Let's get back to normal life as fast as possible and forget it. This mistake must not be made, and there's a chance here for the US to show leadership.
Thank you. That seems to be a common theme. We're getting a couple of questions, Dr. Udayakumar, that I wanted to address, and it's on AstraZeneca and safety. So, from your perspective, I'd love for you to just talk a little bit about the safety issues given the rare blood clots, and how does that play into the distribution channels?
Yeah, and maybe I'll couple the AstraZeneca and the Johnson & Johnson vaccines in this conversation, given that we've just had updates on both. They both use a viral vector platform with adenovirus, and there's some question of whether that's partially leading to these very rare but dangerous adverse events of blood clots with reduced platelets. So I would say that from everything we know, the reason to have confidence is that we have very strong regulatory review and oversight mechanisms in places like the US, the UK, and others, and the EU. We also have a very good safety surveillance system that's been in place. And the reason we know that there are very small safety signals is because we actually are tracking. So 15 events in the Johnson & Johnson vaccine, over 8 million vaccinations in the US would be a signal that if we weren't actually watching closely, would be very unlikely to be picked up so quickly. So we should have confidence that our regulators, our safety surveillance systems are working for the most part. Secondly, just on Friday, we had a very deep review by the CDC's Advisory Committee on Immunization Practices, looking at all the data very transparently the same thing that's happened with the FDA emergency use authorization reviews by advisory committees of the FDA. So we have transparency also in the mix and looking exactly at what's happening. I would say the takeaway overall is that the benefits for both individuals as well as at a population level far outweigh the very small but real risk from these vaccines. If a year ago we thought that we could develop vaccines with the level of efficacy and safety that the AstraZeneca and Johnson & Johnson vaccines have shown, we would be ecstatic that those are far and above beyond what our expectations were of developing new vaccines in record time. We just happen to have now some other vaccines like the mRNA platforms from Pfizer, BioNTech, and from Moderna that have shown even stronger efficacy and even better safety. And so it becomes a bit of a relative distribution of what's available. But overall, what we know is that the vaccines that have been reviewed and authorized by a stringent regulatory authority like the EMA in Europe, the regulator in the UK, the FDA in the US, all have very good efficacy and safety data behind them. And we are likely to see even more vaccines authorized over the coming weeks and months. As I showed in early on in this hour, the AstraZeneca and J&J vaccines are especially important for global access because they're able to be scaled. And in the case of Johnson & Johnson, it's a single dose, which can be a game changer for many parts of the world with low resources. And they don't require the same ultra cold storage as the mRNA-based vaccines do. So they have some very attractive qualities that allow them to be more useful as well. Unfortunately, we've seen vaccine confidence take a hit specifically for those vaccines because of the rare but real side effects that they have.
Thank you. Thank you for clarifying that. Dr. Ellwood, we have a couple of questions about the EU, both in terms of
Sure.
what is their role in terms of, or what is their take on vaccine diplomacy, and then what role are they playing in vaccine diplomacy? And then also, I just lost the other one, but there was one about, I think about their stance on vaccine equity.
Well, today's news is that the EU has filed a lawsuit against AstraZeneca for the gaps in delivery, which have happened since the start of the vaccine rollout. I don't know whether this lawsuit has much chance of success or whether it has much sense. It certainly won't make any difference to people who can't get vaccines. There is a terrible shortage of vaccines in Europe. It's even hit my own family. And up and down Europe, and so people are scrabbling around. The EU has still not come out of this well. There are now all kinds of inquests about what went wrong. It's perfectly clear now what went wrong. The EU was not prepared, was not equipped to start buying larger amounts of stuff directly from manufacturers. It could have been anything. It could have been buses. It could have been curtains. It could have been dog kennels. They were not equipped to buy directly from manufacturers enormous quantities of anything. Procurement is not in the EU's DNA. It is in the DNA of every national government, of course. It's not in the EU's background or upbringing in any way. And they weren't able to coordinate the 27 members. They weren't able to agree on, they were desperately worried about price. They were desperately worried about liability. If something went wrong, they were desperately anxious to cover their backs in case there was, legally, in case things went wrong. And that was a reasonable worry, a reasonable source of anxiety. But the result was confusion. And the result was a great deal of lack of prestige and lack of standing. And the situation now is that things are picking up. And we certainly, by the time the summer comes, there should have been enough rollout from Europe's factories, Europe's Pfizer factories, Europe's Johnson & Johnson factories, and so on, to meet the needs of most people in Europe. What really matters is what happens next, because the EU has promised this giant next generation recovery fund, which is the equivalent of a giant Marshall Plan, but much more longer running than the Marshall Plan was. It's one of my favorite topics. and they need to get the profile, they need to get the image, they need to get the glamour of the Marshall Plan. They need to sum of that up. If that works, and if they produce anything like the results that they're counting on, then all this drama and the saga of the vaccine rollout and the misery and bureaucratic confusion, that will be forgotten. I think that will be forgotten and forgiven. But it's a big bet, and the bet is very much still open. Within the next few days, every participating member has to produce its plan for how it's going to use the recovery funds. And they're quite specific. They're things like greening, decarbonisation, digital upbringing, digital updating, infrastructure works. They have to have specific plans. Let's hope they're not too specific, because they'll start wasting weeks and months going through these plans, picking out details, arguing, so on and so forth. That's the next big bet. If that works, even to any significant extent, then this phase now of confusion and disarray will be, as I say, will be forgotten. But it's still a bet, and we still have an awful long way to go to vaccinate the majority of Europeans.
Thank you. Thanks to you for clarifying the situation in the EU. We're almost at time, and so I just wanted to wrap up with a couple final thoughts from you both. If there is one thing that you would like the public to know about vaccine distribution or diplomacy, what is it? Or if there's like one myth you could bust, or just one important detail that you think everyone should know, what would that be? Dr. Udayakumar, we'll start with you.
Yeah, I might just reemphasize that it's in all of our self-interest to make sure that we have global access and global equity to vaccines. We hear over and over that a pandemic won't be over anywhere until it's over everywhere, and that really is true. And so the more we can do to support global access and equity, the faster we can end the pandemic for all of us.
Okay.
Thank you.
Yeah,
and Dr. Ellwood, what about you?
Yeah, my one thought is keep taking the medicine. Even if you've been vaccinated, keep up the protection. Keep wearing your mask when you go out. Keep washing your hands. Keep careful. Stay clear. Stay clean. Keep protecting.
Good. Yes. Good advice on So on that note, thank you both for taking the time. I personally have a lot more questions, but unfortunately we're at the hour. And thank you to everyone in the audience who asked questions. They're excellent. I really appreciate the work you're both doing. It's interesting to get two people from different backgrounds together in a room, but I think it just unveils so much about the topic. So thank you both. Very much. Just a few housekeeping items. Our next event is on Wednesday, and so we'll be, yes, Wednesday. I'm never quite sure what day it is. Wednesday the 28th at 12 p.m. Eastern time, and it's on the use of sanctions in foreign policy. Because as we all know, this is increasingly a tool that is being used. And so we're looking forward to good discussion about that. And then just as a reminder to everyone, you can RSVP there. We are also a nonprofit. We're trying to keep these conversations free and open to all around the world. If you can donate, any amount helps. So thank you very much. So with that, Dr. Udayakumar, Dr. Ellwood, thank you very much. Have a wonderful day. Have a wonderful evening.
Thank you, Courtney, and thank you for introducing me to my colleague from Duke. That's great.
Quite welcome.
Same.
Thank you. All right. Take care. Bye-bye.
Bye-bye.
Bye-bye.